the situation with primary health care, because there's been a lot of people who've had their opinions about the situation in the health sector in the state. Most recently, we had employment into that sector, I think about 500. That's the number that was given. Well, is that enough? So many would say we need more. But beyond that is to also consider the welfare of the health workers, access to medical services, basic healthcare services in various communities, not just in the capital city, not just in Falgar and Obiakbo, where we have the concentration of residents, but in those interior communities. What is their access level to basic health care? And the health workers in those areas, what is their welfare like? Do they even have the required tools to do their job? Now, all of these would form our conversation. What plans is the government putting on ground to help address that problem? Whereas if you check some issues with regards to the situation with healthcare in Rivers State, there's a document you would find online at the nigeriafreepository.org.ng. is a document there about the Rivers State Statistic Health Development Plan. And in that document, it was highlighted some of the problems that the health system in the state is going through. Now, whether those problems have been tackled, because this report goes back to as much as 2015, and it talks about poor quality of service, loss of consumer confidence, low utilization of services, low staff morale. The list goes on, and you could go and find out more of the details. And if you also remember, River State coming up to number 2 with regards to the HIV prevalence in the country. And the next question would be access to these retroviral drugs. It's a lot of conversation. Preventable diseases also causing a lot of havoc. We have the cholera, malaria. Do we have the necessary requirements to ensure that Rivers people can have access to health care? And those who are giving this health care, are they well taken care of? Very fundamental question. In the meantime, as we wait on my guests to give us more information about this, especially as it concerns doctors who are employed under the government system, I would like you to respond to this question. Go on Facebook and you find, do you have adequate basic health care service in your community? Where you are located right now, or in your village, do you have adequate basic health care service? Now, that's a question we would need you to respond to. If you go on Facebook at Nigeria Info 92.3 PH, on X, Nigeria Info PH, on YouTube, Nigeria Info PH, on WhatsApp, you can send your response to us with the number 0809 030 6416. We had plenty of investments in the health sector, especially we had the Mother and Child Hospital, for instance, started under the last administration, and this administration saw that, okay, we have that working. There are questions about even where we have these hospitals, do they have the facilities? Is there a system that encourages them to perform optimally? What is being done to those people who work there? We are having a current crisis of brain drain in the medical sector, where we have plenty of health workers relocating, leaving the country, going to apply their trades elsewhere. And the major complaint that they give is, well, our welfare is a problem. It has resulted in strikes. It has resulted in patients, Nigerians, suffering at the end of the stick, because when these materials are not available, and then those who are supposed to even do the job don't have what is required, you can only imagine what the end result would be. And so, beyond just building structures, do we have system to help the medical sector work better? The complaint about politicians traveling out of the country, medical tourism, and the monies that we spend out there. Whereas we could do the right things here in this country and have a proper welfare plan for health workers to see that the least Rivers person can have access to health. What plans are on ground is what we would find out from our guest. But let us first hear your thoughts about whether or not you have basic healthcare service in your community. So you can call us up on 0817 923 0003. You can also call us on 0817 923 0002. Or you send us a WhatsApp message on 0809 030 6416 0809 030 6416. While we wait on your calls, my guest just arrived in the studio, so we're going to get him to respond to some of the questions that I've been asking, but we still await your thoughts. Very important that you share this with us. Do you have access to adequate basic healthcare service in your community? What is the situation like? There are some places where we don't have health centers, so they're not even functioning. The government health centers that they have there, some of them don't have the necessary tools for medical staff in those places to carry out their duties. Well, sir, you're welcome. The chairman of Government Employed Doctors, Dr. Hanacho Alexander. Beyond that, he's been all over the country. He previously worked as the medical officer in charge of the Kaduna State Water Corporation Hospital, also at the medical officer Bayelsa State Hospitals Management Board and Primary Health Care Agency, formerly clinical tutor, researcher, College of Medical Sciences at St. George. Sir, you're welcome. Good morning, Doc.
Good morning, sir.
All right, we don't have a lot of time. We just have the next 4 minutes. We'll go for a very short commercial before we come back and continue. But let me quickly just put this one to you so you respond. What is the improvement, or what has been the state of the healthcare health system in Rivers State from where we were under the past administration to where we are now? What difference? What is being done that is different?
Thank you so much. A lot of differences have been made within the short time of the current administration of the executive governor, Sir Siminalaye Fubara, who took over mantle of leadership of our amiable state a few 9 months back, and a lot of things he has done could seem he has been on governance for the past 8 years, if you permit me to say so. Why am I saying this? The best thing here on the banner that people could see, you will know that the health workers have been stagnated since 2015. They've been stagnated.
But by stagnated, how do you mean? Because we know that under the past administration, we had investments in the health sector as well. It wasn't as though nothing was done. We had considerable amount of investments, and we'll go into some of those. But what do you mean by the health workers have been stagnated since 2015?
You mean, Socrates said that when you build man, you build the society, because it is the man you have built that will in turn chunk out the resources to build the society. Like the road constructions you are seeing, without a good engineer, you cannot see those things happening. So it is to the health sector. The stagnation means they have not been promoted. Their welfare had remained as long as any doctor or health worker for the past 8 years here in Rivers State.
These are for government?
For government, yes, workers. For government workers.
At the state level?
At the state level. At the state level. In fact, even when remunerations, things are approved, allowances, it doesn't get to us here in Rivers State. I want to drive our mind back a little, especially during the COVID. You see that doctors were working day and night. They never rested. And COVID allowances were even dished out to the various states. Rivers State was among one of the epicenter states after Lagos then, and you know what happened here. But what benefit did the doctors here receive?
There was a lot of protests and conversations around these COVID hazard allowance and the rest of them. So you're implying that the state government at the time under the administration did not make the payments, or health workers did not get those allowances?
The health worker, we didn't get those allowances. We are just working. We never got. We are waiting for it to be given to us, but it never got to us.
Is it paid now?
That is
or is it something that's gone water under the bridge?
Well, that should be a discussion for another day. Because why we are being stagnated is that we are not being promoted. Yes, and our counterparts in the neighboring states like Bayelsa, Akwa Ibom State, Delta State are being promoted. A worker.
All right, Doc. Yes. I told you we have a commercial shortly, so just stay. We'll continue on this line of thought.
Thank you.
For how
While we were on the commercial, sure, You must have been interacting with Facebook. If you haven't, you should. We will be taking some of your reactions to that. We really need to know the question we're asking, even for those who are listening, at basic health care service in your community. Do you have access to it? Let us know what your thoughts are quickly on Facebook at Nigeria Info 92.3 PH, on WhatsApp 0809 0306416. Now, let me come back to my guest. Doc, so you were telling us, trying to explain what you meant by stagnated. Health workers, doctors have been stagnated. So yes, I'll just let you continue on that.
Okay,
that line
thank you. Stagnation, I mean, you are due for promotion, you are not promoted. You know, the joy of a worker, a civil servant, a doctor, the doctor has no other business than to look after the patient. That is his farmland. The hospital is his premises. Day and night taking calls. But at the end of the day, when you are due for promotion, you are not promoted. Even the annual increment that comes doesn't come. Required salary structures that are meant for the doctors, like we'll say commerce, is not given. You are here in this state when they spoke about the adjusted minimum wage structure during the time of Chris Ngige as a minister for labor. It was not implemented. They only had a tripartite committee here in Rivers State. And the report of that committee is yet to be known until the last administration. And you know what that means? The economy is not smiling at all.
You're saying some of these things are responsible for why we don't get the desired output that you might expect from health workers?
Well, not exactly. Even amidst all this, you know, when you go to hospital, you see the doctors working tirelessly, hoping that a day will come, they will be remembered. And that day is here today, that they are remembered. As
true as this may sound, I'm pretty sure there are some Rivers people that would differ with you to certain degrees with regards to the experiences that they've had with health workers at different government hospitals and in this state.
Yeah.
I'm sure if we open the phone lines, you would get some reactions that would be quite different, and that would bring us to within the medical community. There are also talks about divides, or doctors seem to be above, and sometimes what they get is more than what, maybe a lab attendant will get, or a resident doctor, or you would help me with the various. But there are conversations around all of those as well. So as much as we are looking at the government and saying, well, the government should have done this, doctors, workers, healthcare workers have been stagnated, should we also be concerned about internally whether the right thing is being done so every health worker is well represented?
Well, I will tell you the truth. The doctor is the arrowhead of the health sector. We all know when you people go to the hospital, who do they go to see? They definitely go to see the doctor.
But when you give us the prescription, then we need the pharmacy.
Exactly.
When we go to the lab, we need somebody to do the test.
I am not jettisoning them.
If they don't function,
but no, they function too.
Okay.
But what I'm saying, if you look at my presentation, I'm talking about the health sector in entirety.
In general.
Yes, I did not come here to limit it to just doctors, because we work holistically as a family. It's a teamwork. If the doctor does his own, the nurse is there.
So
the
are their interests
yes.
also represented adequately?
As at then,
yes,
what we suffered is what they suffered. But as I talk to you today, their interest is adequately represented. In fact, let me cast your mind. On the 31st of December 2023, when the governor visited a facility at Akpajo, Eleme, you can watch the clip. I had the privilege of talking to him. He came to see on-the-spot assessment. That is first of its kind that the governor visited the facility. That happened during the time of Rotimi Amechi. For the past 8 years, that has never happened. He visited and see jubilations, and I presented to him the poor state of healthcare workers, spanning the doctors, nurses, pharmacists, lab technicians, community health workers, those ones that do give immunizations at the healthcare centers, and every other and non-medical personnel that are there. It was here, and the governor gave a firm promise that they will be converted, they will be taken, because there is a regulation from the National Primary Healthcare Development Agencies that all the health workers at the local government level to deliver the universal healthcare coverage, they should be pulled directly to the state primary healthcare management board for proper administration and care, so that they can take what is due them and benefit with their like their past in other places. And the governor gave a firm promise that will be looked into. Today, as I talk to you, he has started. They've done their promotions. Their documents is on transit to move to the state. You are aware, even the local government chairman declined recently to pay the minimum wage and the new salaries, saying
we didn't hear them say that, the local government chairman.
It's an information of the public domain. They were dragging their feet. To exercise that function, that authority that the governor mandated them to do. But many of the local governments have finally done it. They've keyed them in. At least they are not taking the minimum wage of 30,000 naira. I mean, the healthcare workers and other workers in the local government area. Today, they've been issued with their promotion letters. The healthcare workers, both that of the nurses, all of them have taken their promotion letters. And again, it is being inputted at the local government level where they work, so that it will be harnessed and be transferred to the state for onward total implementation to ensure the universal health coverage principles is being adopted. Remember, our governor is a governor that takes health first. You are aware, you are seeing what he is doing.
Which is to bring me to this question, because while we can say, okay, kudos to what we have so far, it brings more questions. You've talked about the stagnation in the human development angle in the health sector, and we know that under the past administration we had some investments in the health sector, even though you would say it didn't have to do with the workers, but we had structures that were built, we had hospitals that were built, and all of those. Now under this administration, where it seems as though taking health the workers as priority seem to be the case, the tools that the workers require to do their jobs is also another question, especially in the communities. There are reports of some health centers where they don't have syringes, are not enough to even do the works that they need to do. The hospital beds are something else. You don't even have a seat to sit down. Are these complaints noted, and have there been any conversation with the government to look into also, beyond taking care of the workers now, to also providing the necessary environment for these workers to now function effectively?
Thank you so much. You see, these things cannot be separated from one another. While we talk about human capital development, improving the welfare of healthcare workers, we cannot also equally say the facilities should be abandoned. The facilities have never been abandoned.
So what has been done in the past 9 months in those areas?
In the past 9 months in those areas, like I told you, if you go to the health centers, you will find out that there are a lot of renovation works going on. We are centering on the primary healthcare centers.
Which
now.
Of the health centers in which local governments? If you can give us an idea on which areas that work are ongoing at the moment.
At the moment and commission.
Yes.
In fact, only recently you go to like a Mohua local government area, the primary health care center there, where the health authority have just been commissioned. I will tell you that, yes, I'm giving you that for free. And there are a whole lot of other healthcare centers too that are yet to be
done by the state government.
Yes, renovation done by the state government. The state government is, renovation is an ongoing thing. Maybe what people are expecting is that they want the government to come and build a new health facility. No, the facilities are there in the over 344 health centers this River State has. If we don't know, many of us don't know, and all those health centers are functioning. As I talk to you,
isn't it something that local government councils are in charge of? In trying to, at least we know that in MOA local government, the council chairman has been very vocal about the health center and working. So the expectation is, you're saying now that the state government is behind the project, not the local government council?
Okay. There is a way these things work.
Please tell us. Let's get a clear understanding.
Yes, the primary healthcare center that has been pulled directly to the state. The state healthcare primary board is the managing body in charge of all the healthcare centers in the 23 local government areas of the state. So there is a joint relationship between the local government and the state government when it comes to primary healthcare management or functioning.
So it's a collaborative effort.
Yes.
All right,
yes,
that makes much more sense.
It's not that the local governments are not doing anything. No, they are doing something. They are there. They get part of the. So primary healthcare normally is supposed to be the primary first level of healthcare to the people, which is the grassroots. Yes, but the state government is equally cushioning a kind of a collaboration, bringing some high-level manpower like the doctor, pharmacists, and to support the healthcare workers.
What is the situation with workers? Where we have the complaints of workers that are not even in some of these health centers, in some of the local governments. We're going to go to the phone lines and WhatsApp messages so that you get people to tell us more. So we need you to explain to us in that area.
Workers are there, but the number of workers are few.
Why?
Because there has not been employment for the past about a decade.
The 500 workers employment did not. Was there any that was? That the governor recently announced for the health sector, 500.
That is just.
Is it only for doctors?
No. It's not even 500. Most of us are not. It's 1,000.
1,000.
500 for the River State Hospitals Management Board.
Okay.
Which is the board saddled with the responsibility of providing secondary health care for general hospitals at the cottage hospitals, and at the same time. The River State University Teaching Hospital, 500. Not just doctors, pharmacists, all level of manpower to drive the health sector.
So amongst these 1,000, because if you said for secondary, it means we do not know what happens to the primary health care center.
The primary health care is about to receive her own quota of employment. Within this period, you remember, that it is only recently that the governor constituted the boards that will pilot these agencies, the Hospitals Management Board and the River State University Teaching Hospital. They had no board, and with that board, there is nothing that can function or work.
All right,
so it is the coming of those boards that have catalyzed promotions, catalyze employment, which we are now seeing, and a whole lot of things. And the primary healthcare center, the governor has promised vividly. He's a promise keeper. He speaks few words, does more of action. The primary healthcare will soon receive her own quota. And if that happens, which is almost presently, the workers are distributed to man to the various health center. I'm in charge of Eleme local government area. I'm the medical officer there in charge of Eleme local government area, and I'll tell you that the things are functioning very well. There is no no barrier to
All right, Doc.
healthcare service delivery has been anticipated or rumored by people. Some of these persons don't even visit health centers. They just pass. You know, our people have poor health-seeking behavior. They don't. They only come when it is an emergency. And when they come, they get what they give them. They want the healthcare workers to do a magic. Who the healthcare worker?
So in other words, there's a
magician.
certain level of healthcare service a primary healthcare center can give.
Of course.
Beyond that, you have to go to a secondary healthcare facility.
Like in LMA, we have the general hospital, which will take care of those responsibilities. You know, the health.
Sorry, Doc. I know you have a lot to say, but we don't have a lot of time. So let's take a few calls and get some questions from the listener that you'd respond to. Promise, Muriel, Samuel on the line. So we start with Promise from location. Please just go to your question and respond to the question we also put online, whether you have adequate access to primary health care service in your locality. Promise?
Yes. Good morning. Good morning to our guests in the studio.
Yes, good morning. Go on.
Morning.
Okay. Actually, I'm from Obia Boya. And actually, we normally attend this Rimibo Health Center, which is we are my wife to give birth to my children. Which in terms of that, this Rimibo Health Center, they are well functioning. But they have just made one comment about Omegwa. There's one health center in Omegwa which is not functioning. I can tell you the place. You can do pass almost every day.
Please do.
Can I mention?
Yes.
Do you know Elebrata Johnson, Oduha Johnson?
Yes.
There's a health center opposite Oduha Johnson, which as I'm talking to is not functioning, and they have vandalized every fucking damn thing in that health center.
Mind your language,
So
Promise.
Promise,
Please mind your language.
every health center I think I guess is mistaken.
All right.
I know that one very well. That opposite Oduha Johnson have been vandalized. It's not functioning.
All right, Promise. Thank you. Let's go on to Muriel now. Thank you, Promise. The doc is taking note. Let's go on to Muriel. You made your point already. Let's not beat around the bush or recycle what you already said. Muriel from Okrika, good morning.
Hi, Femi, good morning.
Good morning to you, Muriel. You're welcome.
Thank you. Femi, in my community, there is only one it's not a health center. It's a general hospital. We call it general hospital.
In Okrika, is that it?
Yes, Femi. And our health center was converted into a military barrack, honestly. Yeah, and I don't know your guess if there is a way, if there are plans to set up or build NHS centers in some communities. I think they should really consider my community, because I don't think there is any functional health center in my community. The one we had has been converted to something else. And I thank God the health person is here. I don't know what is the reason why this mother and child hospital has been under lock and key. What is the reason? Maybe he has an idea. And this Dr. Peter Odili cancer
cardiovascular, yeah.
I'm hearing that they want to convert it to something else. I say it is totally unacceptable.
All right, Muriel.
We need a cancer center, a government cancer center in this state, because there are so many places that we cannot even access the private healthcare centers. So government needs to bring out one.
All right, Muriel, your question has been noted. Let's get back. Let's get to Samuel in Rumukalagbo now. Samuel, good morning. We'll take more calls. Hello, Samuel.
Good morning.
All right, straight to your question, please.
I want to greet your guest in the studio. Whatever thing that he's saying today, I think I agreed with him. This health worker under the past administration, they didn't benefit anything. I remember even the head that built by Chivika Mechi in my local government in Ahoda East, being a Ihubogo community where the former local government chairman came from, Chief Dr. Cassidy came from, where is my community. The health there is working up to today, up to tomorrow. The health there is working. And I want to agree with the guest in the studio that under the past administration of Mr. Winke, the health worker had not benefited anything. Thank you.
All right, Alozie from Omuma, let's hear you. Good morning.
Good morning, Ifemi.
Straight to the question and straight to the point, please.
Ifemi, my own locality here in Omuma local government, where I'm calling you from. Ifemi, for over a decade now, there is no government-owned hospital where surgery can be conducted. The only River State General Hospital we have at Omo Bashiberi, the condition is nothing to write home about. It's pure moribund. And the thing that pains me most is there are people who are health workers reporting in my LGA from Omoma local government for healthcare system, health center at Amadi. Bush, it has grown up to something else, I don't know. The one at Omoba Shebeli, the one at Omoba. We don't have good healthcare in Omoma local government. Go to Omoma, do your investigative journalism to confirm what I'm saying. I'm not speaking in supposition. What I'm telling you is what is happening in my local government. There is no government-owned hospital where surgery can be conducted in the whole local government. Pregnant women travel from my local government to Abia State because we have common boundary with Abia State, continental, on a daily basis. Yet, we have River State government.
All right, Alozie. Point taken. Let's go to Buguma. Buguma, George is in Buguma, and then we take Dakuku in Echie so we can come back to my guest. George, good morning.
Yes, yes, Andrew. Good morning.
Yes.
And let me also greet your studio guest.
Straight to your question,
the
please.
Talk in the studio. Yes, you see, Andrew, I don't have much question because in my LGA, as I speak to you, the health center is functioning very well. You understand? But those who want to play politics with what the dog there is saying, I think they should stop forthwith because looking at the current governor of River State, who is very simplified and who is working tirelessly to see that things are put in the right perspective, I think we should give him kudos rather than try to pull him down.
All right, George, we get your point. In Buguma, the health center is working.
And he has said the truth that the governor is up and doing. The governor has not failed the people. He's very close to the people. Putting
all right, George, I think you answered the question already. We have to move on. We don't have a lot of time.
So
Thank you,
George.
Dakuku from Echie. Let's hear you so we come back to my guest. Good morning.
Good morning, Nigeria. Good morning.
Yes, go on.
This is Dakuku from Apoket. Let me go to the health center we are talking about. Go to Echie. No health center is working. The general hospital, no one is working. Because government could not even do anything to reverse function Echie. I'm just telling you. But I know him able to reverse all this, do nothing to take. I'm just going for him. No health center in the day is working. When you come to Obia, I'm just telling you. The people are not care about the people of the masses. I'm just telling you. If I don't think at all, I think that's a very good guy. Let me turn up the RAM. The all reverses to make sure that all those health centers and general hospitals are happy so that people can be able to access their health very well. Please. Thank you.
All right, Dakuku. All right, quickly, I just add messages from WhatsApp, a few of them. Okay. The answer is capital no. This one says they don't have access, because the past administration didn't focus more on building infrastructure and didn't invest in the health sector as much. But they are hoping that under this administration, it would bounce back. Lorenzo Delight says, okay, that's enough for us. We can't take those. But you heard some of them. This one says, Andrew, good morning to you and your guests. Healthcare workers at government facilities are not doing their job. All they do is money, money, money. Patrick Dadado Idara. I've not been to the state, any of the state medical facilities, but I've witnessed what happens at the federal medical facility in the state, and some reports that we also got about how you have to pay for a glove, pay for a syringe, pay for this. Is that also the situation in the state facilities? Because this message here is pointing in that direction where you pay for this, you are buying this and paying for that because these facilities, these things are supposed to be available, but they are not.
Not at all.
Is that the case also in the health center?
Let me just take this one.
Less than 3 minutes.
Yes. Recently the Primary Healthcare Management Board, headed by Professor Kenekanwo Green, who swing into action. He's still less than a year in office, and I'll tell you that there were reports of people collecting money for immunization, gloves and syringes on these things. Those things were quashed. They were not true. You go to health centers, we are on air that when you go to any health center and they ask you to pay, bring a report to us. The numbers are there at the public domain for them to get their report. Since then till date, we have not seen. We go for inspections, we go for supervisions. unannounced.
At
on
all
the
the
spot.
primary health centers,
Yes, at
over
all
300 of them.
Over 300 of them.
And you're saying that you have all of these
Yes,
materials available, provided for by government.
Provided by government. Provided fully. I beat my chest. I stand to be challenged. Because I'm a grassroots man. And I go around to see my colleagues, my workers in these health centers to see what they are doing. And not only me, other agencies, you know, we work in collaboration with donor agencies like UNICEF, WHO, Gavi, mention them. They go, they tell you and give you the report. And it's not for me. These are neutral bodies. But for today, as I talk to you, nobody. Let me answer the man I spoke about, our local government area. You know, that is my local government area. I'm passionate about it. And I want to tell you that there is a functional health center in Odoha, inside the community. That health center along the road was built during the time of Amechi. That time, and what happened? The people said it was not accessible to them. They cannot cross the express to go to that side. And that place was converted to Ebola center. During that time, if you remember something, that was Ebola outbreak. Center. Yes, outbreak, infectious disease center. Then a health center was built inside the community. As I talk to you, it's functional. It's functional, very functional, protected and accessible to the people. Maybe these things, people just see what people don't take time to go inside. In Okrika, where the lady said no health center is functional, it's not. No,
she didn't. She said it's not functional. Yes. Or it has been turned to a military.
No. I don't know what she meant. I don't know what she meant by military. Okay. I don't know what she meant by military.
But what's the situation?
The health centers there, the general hospitals there are all functional. We have doctors who are working there. As I talk to you, maybe some persons don't go to health center. They rely on the rumor, what people have told them. That is the scenario with Nigerians. People don't really take pains to visit those places and give you a feedback. As I talk to you, go to Okrika corner, the health centers are you hear the mixed feelings. People are telling you no, it's functioning here. So these are the situations we have here in our state. Since the governor came on board, I talk to you, you go to the dental maxillofacial hospital at Garrison and the ophthalmology center. He has separated, pulled it out from the Arusu. It's an extension. In that place, you have the ENT, you have the eye, you have the dentistry in that place. And these places we do train high-level manpower, conduct residency training, employ manpowers are already employed, and employment is
let's go back to Okrika. Muriel,
yes.
She also asked another question with regards to, and it's a question that I had put to you before, the Mother and Child Hospital, the Elderly Cardiovascular Hospital. What is happening with those facilities?
The governor just came on board, and he's passionate about the healthcare. If you just give him some time, if in less than 1 year that he's in office, the Casey Harrison Hospital is already functioning. You are aware the former Niger Hospital at Emenike is functioning with manpower service delivery. That place functioned last during the time of Rotimi Amechi. The dental maxillofacial hospital too functioned last during the time of Rotimi Amechi. But today is functioning. He has put everything state of the art.
But for the dental, when you say functioning, do you mean you're saying under the last administration it was completely moribund?
Yes.
No singular activity.
No.
It wasn't working.
In fact, if you go to the teaching hospital, former BMSH, which is now the River State University Teaching Hospital, the dental department, dentistry department was confined to a caravan, a porter cabin. You go there, the structure is just there, but they have moved. A mobile clinic, this porter cabin, the camp they use to go to, you go to campsites where offshore workers are working. That was where the dental department was confined to throughout. Until now, they have moved to Dental Maxillofacial Hospital, where they have a full department for training, employment, service delivery, anything state of the art as it is in the past. Remember, that place was the best in the old Eastern region.
What about in Echie? A caller also,
yes,
and then a message from Jonathan also said here that in Echie, they don't have that the center there's collapsed, there's the structure and no health worker.
Like I am just saying, no, that you cannot say there are no health workers. There are health workers, but if the center is vandalized, and this brings me to bear to tell you that when government gives you a facility in your place, it is your duty to protect it. In primary health care, we talk about the community owning it, own your facility through the WDC, World Development Committee. Own your facility. What do I mean? Protect your facility. Don't vandalize it. You cannot go. It's not somebody that will come from a MOA local government area that will go to a church to vandalize it. Why will you vandalize what government has given to you when their resources are lean and you want government to keep doing one thing over and over? The government is not a government of wastage, but the renewed hope is that Sir Siminalaye Fubara is here to say, cry no more. Health care delivery is at your beck and come. And recently, he has just launched the River State Contributory Health Protection Program. River State was the last state and the only state that has not keyed into that program, this health insurance. But recently, he has commissioned it. He has appointed the executive secretary there to work, Dr. Veti Agala, who is the vice chairman, one of Nigerian Medical Association.
All right, Dr. Woki Hanacho.
And last week it was opened.
We're already out of time.
I know soon. I just want to say that Rivers people will soon have health care like bread and butter.
Thank you very much. I wish you had made it here earlier. Unfortunately, you didn't. But we have to go now.
It's in series. I want to say that this in series.
I will definitely invite you again.
Yes, thank you so much.
Thank you very much. Let's go on to for the news at 9. My name is Ifeemi Andrew. Hello, Port Harcourt comes up after that. Stay with us.